going to be going over the essentially the pregnant body and you. So what can you expect through your pregnancy, your 9 months of creating life, benefits of exercise during that pregnancy, reasons to absolutely avoid exercise during pregnancy. That's a really important one. And then we have exercise variables to be aware of during pregnancy. Okay, so we're going to get right into it. And this lovely young lady will be assisting us through our presentation. So the pregnant body and you, they're trimesters. You're pregnant for 9 months, right? So we can essentially take 9 and divide it by 3, make up our 3 trimesters. You could do 1 to 3 months, followed by another 3 months, followed by another 3 months. Or sometimes we talk in weeks. So 1 to 13 weeks is the first trimester, 14 to 26, and then 27 to 40. And here's our lovely young assistant. So for the first trimester, we're going to notice a decrease in blood pressure actually, and that's because even though the heart rate is actually increasing and you're going to see a higher, stronger contraction of the heart, the vessels around in your arms and legs are going to dilate some. So the plumbing externally is going to be easier to get through. There's going to be an increase in flexibility of ligaments. You're going to notice the hormonally, so there's a release of a hormone named relaxin, and that's essentially to get your body ready for delivering the baby. And there's an increase in fluid retention. So a lot of people will come to us, Jessica, I don't know, your experience so far, but people will come with a lot of swelling in their feet. We'll notice that's because of an increase in just general fluid in the body. We say plasma of the blood, but really just fluid. We'll call it fluid retention for our purposes. We'll start to notice an increase in nausea, so that morning sickness that you hear of in movies and things like that. And then again, I don't know how many of you actually have experience being pregnant or with a pregnant partner, but yeah, in that first trimester, you start to notice that morning sickness. And then you'll see an increase in the arch of the lower back. So our assistant, you'll notice she has a little bit of a belly. Typically, actually, in the first trimester, it's pretty not noticeable. It's more the arch of the back that signifies that first trimester. Then we get into the second trimester, and you'll start to notice that the belly a little bit more. You have still that decrease in blood pressure and the increase in the heart rate. Flexibility of the ligaments is still high, but you're actually going to notice a decrease in the release of the hormone relaxin. Still the increased fluid retention, the increasing nausea, and the arch in the lower back. And then you start to see a return by the last trimester, so the final 7 to 9 months. Returning heart rate, things are starting to normalize a little bit. Still high flexibility of the ligaments because we're getting ready to pass a baby through our pelvis. Okay, so it's a closed ring that needs to expand. And then still with the increasing fluid retention, we're going to notice a decrease in the nausea, but an increase in the sense of breathlessness. Now that's because we have, again, our uterus is kind of starting to push up into our respiratory diaphragm below our rib cage. So it just means that we have to breathe a little more shallow and through our chest. So that's where that sense of breathlessness comes from. And then still with the increasing arch of the lower back, and that actually attributes to a lot of lower back pain that people will come and see myself for during pregnancy. And we go over work ergonomics because people tend to work pretty far into their trimesters. So the benefits of exercise during pregnancy. So you're going to notice for a lot of people in the research have shown to actually have an improved or maintained physical fitness level from before when they were pregnant. You'll notice a decrease in pain disorders. So a lot of people I was talking about will come to me with that lower back pain, some sciatic pain, which would be like pain going down the legs and maybe towards the feet. And then there's a decreased risk of gestational diabetes, maternal obesity, required cesarean births and or operative vaginal deliveries. Decreased recovery times after, so you get back to the activities that you want to do faster. So maybe going back to if you're a CrossFitter, getting back to your personal records. We're going to talk a little bit more about that later though. Decreased risk of preeclampsia or gestational hypertension. That is, remember before in the earlier slides, we talked about how we see a decrease in blood pressure. So we really want to, so increasing blood pressure during pregnancy is actually something we really, really want to avoid. And that's why we do like exercise during pregnancy to help regulate that. High birth weight, that's another something that is decreasing in risk factors with exercise and decrease in depressive disorders. And Jessica, I think you're taking over here, right?
Yeah. So after we know like what is the benefits of doing exercises, I think most of the people are concerned that what kind of like signs or what kind of points I should know when to stop, or what this is abnormal sign of my body that I'm not harming my baby in my belly, and I'm actually are helping myself. So first of all, that the we are talking about the high risk of a group of people, and then the following, there's some medical term that I'm going to explain first. And the first of all is a cervical insufficiency. That means that your cervix is kind of like shortened, and then normally after diagnosed by OB, they will put the stitches on for prevent you getting delay or preterm labor. And then, however, when you have the stitches done, like well, my friend actually, she has a baby last year. She has a cervical insufficiency. After having a stitches, and actually she could resume back to light exercises. However, you have to work very closely with your OB and with your pelvic PT for helping you have a personalized program. And next one will be placenta previa, which means that your placenta was laid lower than lies low in your uterus, and that will partially will completely cover the cervix. And also the next one will be preeclampsia. That means that you have high blood pressure, and then causing you having some other organ system like failure in your body. So under this old medical system, that it all will be diagnosed by OB. And then we here is like we have want to be cautious that like it's like you are having a higher risk of like having other side effects if you being very active. However, it's not absolutely that you should avoid. As long as you work with the OB and with a pelvic PT, we always can help you to remain active life but not harming yourself. And then if you have a severe anemia or have other underlying chronic heart or lung disease, and these people that you should be aware of it. And also you are being pregnant with twins or triplets, and they will like increase the risk factors. However, I do know one CrossFitter, Molly, that you can see in the picture here, that she, can you click, sorry. Yeah, she has the like twins, and she just delivered like in the beginning of this year. She carried these twins and then throughout till she's doing the CrossFit weightlifting throughout her whole practicing life, and then she just delivered half year ago. And here, like all of the points we want to tell you, you need to be cautious, but not like 100%. Like as long as you work closely with OB and then pelvic PT, we definitely can help you to like remain your fitness level. And then next one, I need to talk about like what kind of sign if you're doing the exercises where it happened before you're doing exercises that you need to probably skip a day or rest. So first of all, is vaginal bleeding, or if you have unusual pain and dizziness, light headaches, like this lady here, and where you have unusual shortness of breath, racing heartbeat or chest pain, and then some any fluid coming out from your vagina, have abnormal uterine contractions, muscles cramps. You need to stop when you're feeling these feelings, because that means that your body are telling you that you probably need to rest. The big rule of thumb is that you need to listen to your body during your pregnancy, because your body will tell you what could do, what can I do, what cannot do, because this like your body will be the first person to tell you how you are feeling today. So listen to your body, don't over push it if you feel anything abnormal. And next one, like we need to talk about, it's not absolutely contraindication, but however, you need to be aware of and avoid some postures during the exercises or some when you're having some activities. After the first trimester, you have to prevent lying on your back or prolonged standing, because that will decrease your cardiac output. And if you avoid some high risk of contact following abnormal trauma exercises, such as like throwing a ball game or some sports like CrossFit, that we do have some movements that we will having a high risk of contact or falling. So those like later we can talk about that part. However, try to avoid these like sports, and then try to avoid exercising at altitude greater than 5,250 feet, just because that would decrease your oxygen in your arteries, and then that would decrease the blood flow to the uterus. And then also like try to avoid the scuba diving, just because that will cause you have a compression sickness, and that would damage the fetus. And then another thing is like when you're doing the exercises, remember to stay hydrated, and decrease a loose clothes and dress a loose clothes in a temperature controlled environment, because that can help you to prevent overheating your body, and then help you to prevent getting dizziness, short of breath, or any unusual muscle cramps.
So when to start and what can you do? That's the big question, right? So typically after so I put greater than 12 weeks gestation, which is the time after your first missed period. But essentially that breaks down to, remember we talked about weeks and trimesters. So that's essentially after the first trimester. We want to make sure that we are protecting the developing fetus uh, during that time, because there's just a lot of essential things that are going on. Uh, Essentially, you can work out for 3 to 4 days a week, which is quite a bit actually. I mean, it's a pretty standard routine for a lot of people, and you can work out 30 to 60 minutes a day. And then as far as regulating your intensity, we use, or at least ACOG uses the rate of perceived exertion scale. It's an interesting scale. So it goes from 6 to 20, or some they do a modified version of it where it's 0 to 10. And we'll say you want to go between 12 and 14 for the exercise that you do as far as intensity is concerned. So think of yourself exercising and you can still carry on a conversation with someone. That's essentially where you want to be within, where you're not having to stop so you can breathe and catch your breath. It's you can carry a conversation on with the person next to you. Um, there's something else I want to add about that actually. I'm trying to think. Oh yeah, so we don't want to break personal records during this time. I mentioned earlier the CrossFit stuff. So you have your workouts of the day, everything is time dependent, and during your pregnancy, that is not the time to be going for personal records. Uh, you're going to get through your 9 months. You'll be healthy on the other side, knock on wood, and you'll get right back to it. But a good rule of thumb is that if you are more active going into your pregnancy, you can start out a little more active. So maybe more towards that 14 on the rate of perceived exertion scale, versus someone who's just never been very active. Maybe they worked a desk job and they didn't do any high school sports, and they get pregnant. They say, hey, well, I kind of want to exercise now because I saw this great presentation on safe exercise. Start lower, start more towards that 12 on, light to like fairly light. And then you can work out up until the end of your pregnancy. I mean, until delivery. So don't be afraid to exercise. We highly recommend, and it is recommended by a lot of the institutions out there, that you consult a gynecologist, an obstetric doctor, or a pelvic floor physical therapist, or a personal trainer who has some sort of certification or licensing towards working with pregnant populations before initiating an exercise routine while you are pregnant. It actually may be a good idea to get in touch with one of those people, even when you're thinking about getting pregnant, just educate yourself so you know what you're going to get into. And then exercises that are safe and beneficial. So it's recommended to be walking. Swimming is great. It can unload joints. We talked about that low back pain earlier that people are a little more prone to. It'll help the mechanics of the movements that you're doing just line up a little bit better. So take a little bit of pressure off the back, a little bit of pressure off the hips and the knees, things that are really prone to accepting new loads in a different way during pregnancy because things are shifting and ligaments are more relaxed, right? And then resistance training is also okay. So weightlifting, resistance band training, stuff like that. Jessica, did you have anything you wanted to add here, or to the last
Yeah.
slide? Sorry.
Yeah, so for the intensity wise, like you say that if you already like having like moderate to strenuous like workout routine, just to remember that when after first trimester when everything's stable, just well, I would suggest you like start out from like 75 or 80% of what you're doing the weight wise. That would definitely can help you to get used to your new physiologic changes, and then it help you to start off from there without making your lower back having overstress or making your body are overwhelmed. And then for the resistance training, that here I want to show you one person that her name is like Annie, and she's like a top of the CrossFitter in the world. That she's in the 6 month pregnancy now, as you can see in the picture. She's with a belly, and then she's doing the weightlifting. And then she did like we just want to tell people that I don't. It's not I'm encouraging everyone to be like this. Like even though I want to be like this kind of lady, she's amazing, and she's been training so hard for it. However, we just want to encourage people that don't because you're pregnant and then you're stop doing what you love as exercises wise, because there's so many new researches out there that exercises are definitely are helping your body, even that can help you carry on and help beneficial your postpartum life. And so definitely doing some exercises will be beneficial, and then especially resistance training that can help you, because after you having a baby, your baby is getting heavier and heavier. You definitely need to know how to certain lift some weights and prepare your body for that. So yeah.
Okay, cookies, anyone? No, I'm just kidding. Those are actually fun story. Those are cookies I made for one of my clinical rotations because I started getting into pelvic health earlier on during my physical therapy school. Started going out to different courses out of state, and I came back during one of my clinical rotations after taking one of the courses and did a presentation on it and gave out these as my cookies. I think my artistic abilities have hopefully improved since then. So anyway, what is pelvic floor physical therapy? I don't know what anyone here has, if anyone here has had experience with pelvic floor physical therapy, but if you had experience with physical therapy in general, I want you to close your eyes and think back to that time and what they did with you. Maybe it was for your neck, maybe it was for your shoulder, maybe it was for your knee. But if you think back, the whole point of the physical therapy was that there was something wrong functionally. There was something going on in your life that changed, and it was affecting the way that you lived your day to day life. So let's say for your neck, you had a lot of pain and you had to sit at your computer desk for a long time, and you said, "Man, I can't sit here for more than 10 minutes without my neck bothering me." So you went to the physical therapist, and the physical therapist said, okay, let's take a look at at the joints. We'll look at the ligaments, we'll look at the tendons, the muscles, the nerves. We'll see how those things are impacting your ability to sit pain-free at your desk through your workday. Similarly, with pelvic floor physical therapy, we look at all of those same things and we address the function of the pelvic floor. So whether it's someone who is having pain during intercourse, or they can't hold their urine, or they can't get out their feces because they're constipated, those are all functional things that someone may come to us for. and then we address all of the same things that we would have for someone's neck, such as the ligaments, tendons, joints, muscles, etc. Um, we can handle it with different things like soft tissue massage, exercises, strengthening, neuromuscular re-education, so teaching the nerves again. There are different modalities for it, but it's from someone who's specialized in the anatomy of the pelvic floor. So typically, pelvic floor physical therapy will be provided by someone who's gone out beyond their doctorate level education and continued their education down the route of pelvic health. Jessica, did you have anything that you wanted to add for that? I don't know if we lost her, or if you guys lost me, but if you can still hear me, that's essentially what pelvic health is, what pelvic floor physical therapy is. Um, if anyone has any questions, I'm going to look up here. Let's see. Oh. Can you guys hear me?
Yeah.
Okay. Jessica, did you have anything you wanted to add?
Yeah. So I would say that I do understand that people might will be shy to talk about what's going on down there, which is it happened to me as well. Like before I learned the pelvic floor physical therapy, I was like very shy about talking about what's happening down there. And then I would say the reason why we put out these topics because we want people to understand themselves more. That pelvic floor physical therapy, we can help a lot of perspectives, and then we also can help a lot of people, not just female wise, also male as well. Like if male clients have any problems like a pelvic floor physical therapy also can help them as well. And then yeah, I think, and also if anyone who having in knowing that you have like incontinence of like holding a pee or exercises you have a leakage, those are the problem we can address. Like don't think that after being a mom you should suffer from the pain or should suffer from a lot of stuff people tell you that that's normal. We just want to let people know that what you're thinking as normal probably is not, that like you can always reach out for help and then we can answer you the questions for that. Yeah.
Yeah, and actually,
And
I just wanted to piggyback off what you're saying, that a lot of pelvic floor physical therapy is education, and a lot of people actually wind up getting to me in person, kind of fearful that we're going to do some type of gynecology assessment. Typically, that's not the case. We can a lot of times get away from ever having to go that route. More in, I guess, extreme cases, we would do maybe internal pelvic floor type assessment. But a lot of times it's a lot of education, and it's more externally derived what you're experiencing than you would anticipate. And then
yeah.
here's our contact information. Jessica, did you have something you wanted to share?
Yeah, so like thank everyone for coming for this webinar, and then because we want to like to give out what we can offer during this like pandemic. So we are offering a special package for people that like one virtual session. Like we will help you to address that if you have any questions regarding to your active life or you want to start your active life. And also this is a one virtual consultation and plus 12 workout sessions, which is after the consultation we will help you to customize your workout like through a platform. And then it's like 4 weeks like and 3 workouts a week program that like that does help you to starting your active life if you are like kind of like fear or concerned about it and then you don't know where to search for help. That like we are all certified like strength and conditioning coach that we can help you to as a first step to start your active life. Yeah. So
Absolutely. And in that offer, it's the three of us actually. So we've found that we've made a pretty good team, the three of us working through this, and since the pandemic, reciprocity among states has opened up quite a bit. So we found that we were able to actually work all three of us together, helping individual clients attain goals that they want. So feel free to inquire within. I see we have some questions coming in. James, did you want to read some of those off, or I don't know if there are questions actually. I just see that there's something up
Yeah,
here.
I want to add this one. Like I saw on Gina say Happy Mother's Day to all of the
Oh
moms,
yeah,
future moms. And then we picked today for a reason because tomorrow is Mother's Day. And then we really want to give up some like knowledge or some share some excitement for cheering for all of the moms in the world.
and
Then
the people who are about
Happy
to be moms,
Mother's Day.
right?
Yeah. And so Karen asked that does insurance cover leaks? So so far that Nick, do you want to talk about your side about?
Yeah, absolutely. So we are out of network, and what we do is we provide a super bill to be submitted to your insurance companies. We found that in our experience in working with insurance companies and being in network actually limits our ability to work with people and give the patient the autonomy that they deserve. So we actually are not in line with any insurance companies. It's a cash-based service. And again, you can submit the super bill to your insurance company that we would fill out for you. And either you get all your money back, you get a portion of it back, or just the money winds up going towards your deductible. But either way, it's not money lost towards your insurance company typically. I'll oftentimes tell people to just try calling their insurance companies beforehand and seeing what type of quote out of network benefits your plan comes with.
Yeah. So for our side for Recover we are on cash base as well, and we are trying to work on to do the out of network. But so far, we are only take cash based clients just because that we want to save like a more quality life instead of dealing with insurance company. We would rather spend the time on listening to our clients and then focusing on their treatment goal and then spend more time on them. So far, we are working as a cash based physical therapy. Yeah,
Yeah,
and
and I could add something about the insurance too. And sometimes insurance companies, when they pretty much assess you to see if you guys, I mean, like if you have an impairment that really needs physical therapy. So let's say maybe you want to get into exercise, but your insurance company doesn't see that as something that will benefit for you, so they're not going to cover it. So it's really hard because you don't know. I mean, the whole point is insurance companies, they're trying to make money or they're trying to save as much money as they can. So if they see it as something like a goal that's too lofty or something that they don't see as it's aligned with your goals, they'll probably not cover it. So that's why then it's a whole mess of us fighting for insurance companies to cover it, and then usually you waste a lot of time, and by then it's really hard to kind of cover that ground. So I just want to add it out there. Yeah.
That's a great point.
and is there anyone have like other questions?
So I
So
think we're going to email everyone a recording of this. I think there's a question you can.
oh no, is
Oh, no, that's not a question. Yeah, but I think
congratulations, like 38 weeks pregnant.
oh yeah, later. Congratulations. Yeah, Katie's right next to me right now. But yeah, so Jessica and Nick also treat patients, after pregnancy and beyond. So, even if you're 38 weeks and you're, expecting soon, you could definitely, afterwards reach out to them and they could, help you with certain questions you have. Also, I think later down the road, we're going to have another webinar about maybe getting back to exercising after your pregnancy, and I think that will help more people as well. So I
Yeah,
think that'll be.
we can talk about when and how to start to back to your active life and after delivery, because your schedule and your life probably won't be totally different from what you are having right now. So a lot of people might have those concerns, and we definitely could planned out second like webinar for talk about like postpartum life.
Anything else? Any other questions from people? Where do babies come from? That one comes up sometimes. No? Historic? No one? Okay. Well, yeah, again, nothing else you guys want to add, right? James and Jessica, nothing you guys want to add?
No, I mean, if everyone wants, you have your email address, so if any question comes up afterwards, after this, you could reach out to us, and we'll try to answer everything as well as we can.
Yeah. Or like if you are interested in any webinar like topic to want to know, understand more about it, and feel free to let us know, and then we will try to organize it, and then to see how can we offer this like webinar to people.
Great.
Yeah.
Well, I want to say thank you to everyone who joined us. Thank you, James and Jessica, for coordinating all of this with me as well. Happy Mother's Day to all the mothers, all the motherly figures in the room and in the world tomorrow. And we hope you all stay safe through this time right now. These are difficult, trying times with all the social distancing. Maybe you don't get to see that motherly figure that you wanted to in person. Remember, there are always these avenues that you can go and see them with. So the best to all of you with that. But yeah, stay healthy, and thanks again for joining us.
Yeah, thank you.
Okay, so I'm gonna end the meeting. Okay, when everyone has our contact information, and okay, we're good.
Yeah. So thank you for everyone. Happy Mother's Day.
All right, goodbye. I'm gonna end the meeting now.
Okay.